Changes in skin texture and skin oiliness, for example. Lots of little signs that people may complain about, but that aren't always recognized as part of Parkinson's.
Unfortunately, all of these signs and symptoms can be caused by other medical conditions.
Next, we're going to look at your legs. First,
To rule them out, further testing might be needed. The diagnosis can take time and the experience and training of a neurologist. Parkinson's disease is one of a large number of conditions called movement disorders. That's why a movement disorder specialist can be an important member of your healthcare team.
And a movement disorders neurologist is a neurologist who's done an additional 1 or 2 years just focused in on Parkinson's disease and other diseases that are similar or related diseases.
I think the best thing to do is seek out a specialist in the field of Parkinson's disease. First, a general neurologist who knows the disease, then a movement disorder doctor who understands the disease thoroughly and will be able to guide the patient as to what the person should be doing, when medicine should be started, what kind of exercises to do, and so forth. So getting the right advice is very important.
Either alone or in partnership with another neurologist, a movement disorder specialist can perform the examinations required to make a diagnosis. He or she can also help plan a treatment program to control your symptoms over time.
It's really useful if you can get to someone, a movement disorder specialist, who has seen large numbers of cases and can really treat not just for today, but what you're going to be like 5 years from now, 10 years from now, or even 15 years from now. What you do early in the disease often determines how you're going to do later on in terms of treatment. Proper treatment early is very important. In the long term, I think it's going to be even more important to get an early diagnosis, because there's a lot of research going on now trying to find ways to slow or halt disease progression.
Most treatments for Parkinson's disease available today have been proven to relieve symptoms by helping to restore the action of dopamine in the brain to normal levels.
Dopamine is a neurotransmitter. It's a chemical that cell A uses to talk to cell B. And when that neurotransmitter's gone, it's hard for cells to communicate.
Levodopa is a medication that restores the supply of dopamine in the brain. Also called L-Dopa, it has been used for more than 30 years. Another medicine called carbidopa is often combined with levodopa. This extends the effects of levodopa and helps reduce side effects.
Because L-Dopa has its own side effects, a lot of people like to delay the start of L-Dopa to delay the start of those side effects. Other drugs have therefore been developed.
Here are some other types of drugs your doctor might prescribe, either to take alone early in the disease or along with levodopa later on. MAO-B inhibitors slow the breakdown of dopamine in the brain. Dopamine agonists mimic the role of dopamine in the brain. Anticholinergic medicines are used to help control the tremor that many Parkinson's patients experience. Amantadine may help control tremor and other uncontrolled movements. COMT inhibitors are another class of medicines. They are used only in combination with levodopa to extend the action. No one medical strategy works for the long term. Over time, the dose of medications may need to be increased or new medications may need to be added.
It's a common misconception that the medicines we use to treat Parkinson's disease only work for a certain number of years. What really is happening is that the disease is getting worse, and so you're treating a more severe illness.
The initial therapy of levodopa that I started on was a godsend. I went from having tremors to taking, at that time, 1 pill, which was a very low dose of levodopa that they started me on, and it took my tremors away for a good 4 to 6 hours, and it was like a miracle. I thought, well, this isn't too bad, I could live with this.
But over the next few years, Ken needed to take more medicine, and the relief did not last as long. It's called the on and off time.
Your on time is kind of like what you see right now. I'm sitting here relatively calmly. There's a slight tremor that may not be visible to you, but that I could feel. And that's on time. That's a good time. That means you're in control of the tremor. And off time is the complete opposite. And off time, my leg would be bouncing, my hand would be shaking very vigorously, my voice would be quaking, And what happens during the course of the levodopa therapy is that your on and off time, first they're very far apart, and then they get closer and closer.
We have a lot of strategies when the treatment begins to lose its effectiveness. There are a number of drugs out there now that will make the drug last longer by virtue of keeping it from breaking down. These are very good strategies and minimize side effects as well.
We can help people to work longer, be physically active longer, to have relative freedom from symptoms. And it's a very good quality of life. But over the long term, the disease does progress. The medicine schedules will become more complicated. So we just need to bring more weapons to the battle later on.
The primary non-medicine treatment for Parkinson's disease is deep brain stimulation. Tiny electrodes are surgically implanted in the brain. The electrodes are connected to a small battery-powered transmitter implanted under the skin of the upper chest.
Deep brain stimulation reproduces what symptom benefit you get from levodopa. So someone who finds that their medicine only lasts 2 hours and then it wears off, and they're on a bunch of medicine and they've tried everything and they're still having problems with wearing off. That's the ideal candidate.
That's what Ken was experiencing. The on-off cycle of his medication had become intolerable.
Being that I still work full time, for me that was probably the most frustrating thing with the levodopa therapy, was that roller coaster ride of on and off time.
Any type of brain surgery carries the risk of serious complications. Deep brain stimulation should be performed only if the potential benefit warrants this risk. It is considered appropriate for only a small percentage of people with Parkinson's.
Most patients do not need surgery. Most patients will go through being handled with their medications. It's only those patients who we can't control well with their medications that we have to depend on surgery.
I have a transmitter that's actually in the right side of my chest, almost like a pacemaker, with a wire that runs up the side of my neck into my head, and there's a probe that starts here and goes into the deep center of my brain with electrical contacts on them. So I looked at it from a career point of view, being a young man with a family to take care of, that this was the best decision for me to make. So for me, it was the right choice.
People with Parkinson's disease can take an active approach to their illness, literally.
In my experience, the ones who kind of start just sitting around, the disease just takes over. So you've got to do everything you can to stay active, maintain an active lifestyle.
The most important thing probably is to have a regular exercise program, stretching exercises, because a patient doesn't move fully and completely. Tennis, rowing, swimming, walking, those are good exercises. Some people have to use treadmills, some people go to the gym. Dancing is a good exercise. So something that a person enjoys is probably the best type of exercise.
You might also benefit from physical therapy, which is more focused on such things as balance, gait, and strengthening specific muscles. Lena sees a physical therapist twice a week because of an unrelated injury, but she finds it helps with her Parkinson's symptoms too.
That helped me a lot, because if you exercise and get your body going, it's easier to continue. So that was really very helpful.
Voice therapy might also be a part of your strategy if you're having problems with speech. Healthy eating is good for everyone and certainly can promote overall well-being for people with Parkinson's. Many people with Parkinson's try alternative approaches, such as acupuncture and massage. Always be sure to tell your neurologist about any alternative treatments or nutritional supplements you may be using.
Because sometimes there is something that's going to be harmful. And if the doctor doesn't know about it, he can't advise you. So very important to tell them everything you're doing.
Lena says Parkinson's disease is slowing her down a bit more these days, but she can still get a lot done by planning ahead.
If you want to do major things, you have to find out when your best time is, because certain parts of the day you can't do what you want to do. So you have to organize yourself.
After the last snowfall, when I came back from the office, the path and the driveway had been shoveled, so she'd been out doing that. So it's a typical example of where she does what she always has done.
Quite simply,